first it was just, thinking that, maybe I was just getting old and out of shape or something. I noticed every once in a while I was tripping and stumbling, and, later on was when I started getting the numbness feelings. So I kind of figured I had a pinched nerve or something. It didn't hurt, but I could tell like I was feeling pressure. And it was right around, as soon as I started feeling that in my back was when my legs started going really numb, so I was getting kind of worried. They did the MRI in the middle of the back, and as soon as it came back with the picture, you can see the tumor there. I mean, it's pretty accurate when they show it. You can see the big tumor right in the spine. So at that point, they were like, "You got to go to the hospital right now." He says, "You can't wait. You got to go right now. The tumor has to go to the lab," and they do a biopsy on it. And it came back a couple of days later, and they found out it's what they call, I guess, a benign hemangioma. The doctors spent a lot of time looking at what I had, spent a lot of time researching what the right procedure was. You could tell that they knew exactly what it was they were going to do, where they were going to do it, what the backup plan was, and that was part of the thing that made me feel good. The staff was great. The first thing I guess they do, which I didn't know at first, was they want you to get up. And here I am waking up and kind of getting over the meds and everything, and they're like, "What? You want me to get up?" It's like, "I just did back surgery." He says, "Yeah, that's right. You have to get up though. We want to make sure that you can walk." So I was like, "You sure about this?" He says, "Absolutely." So, they got me up and they walked me around briefly, but it was out of surgery. So, it was a short walk. I walked maybe 5 feet, and he says, That's good. That's all you need." The staff was there. They were great because, they were very patient with the timing and making sure that they answered all my questions, and they helped me walk and move me around, and gave me a lot of explanations of where I'm going next, what's the next thing that we have to do. So that was a great help. It was a really great situation to be nearby a hospital that could handle what I needed to get done. I'm pretty much as strong as I used to be, and I can do the things that I used to do. And I feel like I'm the same person I was maybe 3 or 4 years ago, which is a great thing. I'm 3 or 4 years older, but I still feel like I'm that guy from a couple of years ago.